Thank you all again. As it's been said before, I just want to thank you so much for making our event successful. We're successful because you come, and more importantly, you tell us what you need. This is all about learning about what you can do to salvage what you have left of your brain. As Bishop Adams would say, there's not too much more I can do with it. But for those of us who have a little bit more mileage to go, we want to preserve it in the best way that we can. And as much as we can understand about our overall physical health and how that affects our brains, and the more engaged we can become socially, physically, and every other way, is a whole lot better for our brains. So, this one? There are a couple of things, because we've tried to eliminate doing the Dementia 101, but we've not been really successful at doing that. So just because you're going to hear some things over and over, and a little repetition isn't bad, we're going to go through some very basic things with you today. So what are the things that we want you to be able to do, to be able to understand and recognize the features of normal brain function and brain dysfunction, otherwise known as dementia? We want you to become knowledgeable about the importance of good clinical research participation by women, of clinical research participation by women and other minorities. And yes, even though we are seem to be dominant in this room, women are an underserved minority group when it comes to research participation. And to understand the connection between good cardiovascular health and maintaining brain health. And finally, to describe and to address disturbing behaviors of dementia. We may describe some of those things, like the repetition, but I want you to understand that some of those symptoms are just that, symptoms. They're an indication that something may need to be further evaluated. So what are the things that you need to know? What are the common questions that we get? It's like, what's the difference between normal and abnormal cognitive aging or brain health? Are dementia and Alzheimer's the same thing? What's mild cognitive impairment, and why is it important? How do we know it's Alzheimer's disease? I say, how do we know? Or you might say, if I'm the doctor, which I get all the time, is how do you know? What's your proof? And it always kills me that people who aren't doctors have the nerve to ask me that question. In any event, bear with us. What can we do to treat Alzheimer's? We've got a whole bunch of people here to tell you about what we're doing to treat Alzheimer's, what we're doing with research, and why your participation is so important. And more importantly, can we prevent or reduce the risk of Alzheimer's? And you're going to find that out today. Why is this important? Who is affected by Alzheimer's? Well, as this little bar graph shows, most people who are diagnosed with Alzheimer's are over the age of 85. You start showing signs and symptoms somewhere by the time you're 75, but more than half of the persons over age 85 may have some features of Alzheimer's or other dementia. As we live longer, as the population ages, more and more persons are going to be affected by a dementing disorder. And by the era of 2050, we estimate that there will be nearly 20 million people affected by Alzheimer's. It's important to know that Alzheimer's and related dementias are the most costly chronic disease we have in the United States of America. As this bar graph shows, and you may hear this again, but it underscores the importance of why it's important for you to pay attention to your health. Okay, Alzheimer's costs the most. This says 189, it's closer to $220 billion in terms of healthcare costs. This is a very important slide, and this is one of the reasons we focused on women today. The green graph, the green bar, is women. This is a mortality slide. Regardless of whether you're Caucasian, African American, Latin American, your death rates, if you have a dementing disorder, are higher. That means you are more likely to die from the disease if you are a female. Statistics for Georgia. We have a known understanding of about 100 people diagnosed with a known diagnosis of dementia. We estimate that that is a lot higher, closer to 500,000 people in Georgia. They just don't know it yet because they haven't been diagnosed. Here on this particular graph, you're familiar with the map of Georgia. Down where it's blue and where it's orange, those are where the rates of dementing disorder are highest in the state of Georgia. And right up here, I don't think my pointer works, but you see that little yellow in the midst of all the little tan? That's DeKalb County. So we have very high rates of dementia within DeKalb County, consistent with what we have in southeast and southwest Georgia. Now, why is that? Now, as a primary care doctor, my comment would be that where you see high incidence of dementia, you also have high incidence of chronic cardiovascular disease that's not being managed. Why is it not being managed? There are no doctors there. So you can't know something if you've not been diagnosed and there's no place for you to go. So if you have a legislator, you need to talk about educating people to go into the healthcare field. What other things can I tell you? Here in Georgia, 50% of all Medicare recipients have Alzheimer's or related disorder. 92% of those persons with an Alzheimer's or related disorder have at least one chronic disease. Medicare recipients with Alzheimer's and related disorders have at least 4 out of 10 chronic diseases. It's not an accident that they have dementia. What are some of these chronic diseases? High blood pressure or hypertension, diabetes, hyperlipidemia or high cholesterol, heart disease, cardiovascular disease, chronic kidney disease, anemia, rheumatoid arthritis, depression, chronic obstructive pulmonary disease or lung disease, chronic heart failure. 20% of those persons without Alzheimer's disease or a related dementia have one chronic comorbidity. You see the problem here? So, what is a neurocognitive disorder? Frequently, you hear us talk about Alzheimer's, and up until very recently, anything that had to do with dementing disorders and brain dysfunction was called Alzheimer's. If you are of a certain generation, the word used to be called senility, right? Well, now senility has different colors, just like there are different shades of gray, there are different shades of dementia and senility. So the new word is not senility, it's not dementia, it's neurocognitive disorder, and that describes a whole range of things. What are the symptoms? Memory loss, repetition of words, stories, or phrases, loss of bowel and bladder function, inability to independently dress, groom, toilet, feed, or manage your finances or meals, gait instability. One of the earliest signs of brain dysfunction is instability, gait instability. Personality changes, psychoses, paranoia, people whose personalities change. What are the relative frequencies of different types of dementia? Again, this is a spectrum. Most commonly diagnosed is Alzheimer's, followed closely by a mixed type of dementia. We say most commonly vascular and Alzheimer's disease, followed by vascular disease. That has to do with anybody who has hypertension, diabetes, high cholesterol, all those things that have to do with heart disease. And then there are people who have different kinds of neurocognitive disorder, Parkinson's disease, frontotemporal disorder, Lewy body disease, chronic traumatic encephalopathy, you know, the disease that football players and other people get from getting banged in the head all the time. HIV infection or AIDS, as well as chronic alcoholism or chronic substance abuse. These are the domains that we look at when we start looking at memory function. So when we think of Alzheimer's, it's more than just memory loss. Okay, it's complex attention. How do you manage and process information? It's executive function, the ability to plan, to manage, and to organize tasks. It's learning in memory, acquiring, manipulating, and remembering items, facts, words, their meanings, how to use them. Perceptual is what I'm seeing, making what my brain interprets the same thing. Expressive and receptive language skills. Can you say things? Are the words coming up, using the proper words for the right, naming things properly? Socially appropriate behaviors and decision making. I'm going to keep moving, but most important thing I wanted to get to here, because I have 1 minute, Miss Mary told me, is that if you're 65 years of age and older, during your annual wellness visit, you should have a screen for memory loss or cognitive dysfunction as well as depression. That's part of your Medicare benefit. If your doctor is doing an annual wellness visit, you don't have to pay a copay. It is not a physical exam where you take off your clothes. It is a checkoff to make sure that you have done all of your preventive health things to make sure that you don't get a malignant disease, okay? Annual wellness visit, 65 years of age and older, your doctor gets paid more and you don't have to pay a copay. The cognitive screening is what I want you to get during your annual wellness exam. The diagnostic evaluation, there's a whole lot more that goes to it other than the screen. I've got to stop. The last thing I need you to know is there's no cure for brain dysfunction or disorder. Most of the medications we use right now are used only to manage the symptoms. I'm going to stop right there because the people who are coming after me are going to tell you a lot more in greater detail, a little bit more about what I've said.